Tennessee moving up in the rankings as according to the 2021 State of Mental Health in America, which is good news, how we're serving the mental health needs of our citizens. And we're so glad that we're joined tonight by the Commissioner of the Department of Mental Health and Substance Abuse Services, Marie Williams, and also the CEO of Mental Health America, the Mid-South, Tom Starling, taking an hour out of their day at the end of what I'm sure is a busy Monday. So we do appreciate you both being here. Let's get right back to the lines, and Bob holding patiently. Hi, Bob.
Hey.
Go ahead.
Hi, how you doing?
Doing great. What's on your mind?
My wife is really going through major depression.
Okay.
And a lot of it has to do with her job. Mm-hmm. They've changed her medication also. But she is, she used to be lifeless. Now she's just wants to sleep all the time.
Okay.
And I can't get her to do nothing.
Right.
What can we do?
All right, let's listen in. Hold on. So,
thank you so much for calling in and asking. My first question would be, who is your wife seeing? What agency is she going to? You said they changed her medication. The first thing I would do is to call tomorrow morning to that agency and ask to speak to their medical director or their clinical director, and if you can't get through to them, their CEO, and just say, here's what's happening with my wife. Medication's been changed. She's doing a lot worse. If you do that and advocate for her, I really do believe you will help turn the tide, because it doesn't sound like what's happening is helping her symptoms at all. And we know that recovery is real and treatment is effective. So I would really encourage you to reach out to wherever she's going and speak with the clinical director or medical director.
And, mentioning a medication, it's not, a lot of people don't want to go there. They don't want to be on some sort of a medication the rest of their lives. And really, there's a stigma around that as well. The advancements in pharmaceuticals in the last 10, 15 years has really been remarkable at how well people can do. And it's not necessarily a permanent thing. It could be just a temporary lifeline that a medical doctor who's diagnosed you with whatever you might be struggling with, these medicines can really help in the short term, correct?
That's Absolutely. True. And I wanted to share on that too, because there are many alternative treatments other than medication. I know, we pride ourselves on that here, hey, give me a pill. But I always thought, well, counseling is nice. Everyone needs someone to talk to. But the truth is, there's evidence that it can change the cognition of your brain. Counseling can. There's everything from meditation and alternative treatments. And so I would encourage your professional to always, be open-minded about trying different things. And as to the last caller, just be aware that when you do change medications, sometimes you won't see that positive change for maybe even a couple of weeks. Right. But I like Marie's suggestion of calling them and talking to them.
And following through for sure. And also we're heading, and we just had daylight savings time. We're heading into the cooler winter months where people are going to be inside more, and you have seasonal affective disorder, which I know is very real, because I feel like, I want to just curl up and hibernate. You want to sleep, but I've found just getting outside, going for a walk, being in the sun, getting that vitamin D. There are real health benefits from getting up and moving around. And you talked about meditation. There's so many different alternative therapies, and obviously cognitive behavioral therapy, sitting down, talking to someone is so important, right?
Yes.
It is. The lighting in your house, the food that you eat, your socialization, getting out, all of that is so important to get that blood flowing. I tell people a lot of times, your brain is only as good as your legs. You got to get out there and exercise.
Yeah, and let me just ask you before our next break, despite all the challenges that COVID has created for everyone this year. Is there a silver lining, though? I mean, because it has caused more people to talk about mental health issues, to really start speaking about it, because everyone's kind of going through this shared challenge.
Absolutely. I would say there has been a silver lining because people have been willing to talk about how they're feeling. As I said, there was the study that was done that showed the increase in our state. However, that same study said that almost 70% of Tennesseans actually felt hopeful. They had hope about the future, even though people were struggling with anxiety, depression, and feelings of hopelessness. So I really do believe, and I know Tom and I have talked about this, that if you reach out and connect with individuals, even during this time, even if you can't see a person face to face, doing this kind of interaction by Zoom or doing FaceTime or just calling or sitting out in your driveway and socially distancing and talking. We've seen so many more of those type activities happen in neighborhoods where people are coming together and connecting in healthy and socially distanced ways.
Yeah, Tom.
Right. In the study that we've been referencing, one of the weak areas was accessibility. And that's why I really see us as moving up even more next year, because COVID has really opened the door to telehealth. And as Marie had mentioned, telehealth now is so available. And it's great that even the most rural folks can now have access to a licensed, qualified therapist almost anywhere in our state. So I think that's a big silver lining.
Yeah, absolutely. What else did this report highlight that we haven't talked about yet, Marie? What are you looking at as obviously a lot of good news, but Tom just mentioned, where do you want to improve even more?
Well, I'll tell you, it talks some about services to youth, and that's why I was highlighting the Children's Behavioral Health Safety Net, because we do know that there are youth in this state that are uninsured for a variety of reasons, and this report highlighted that we could move forward in that, and we are. I can't wait to see what happens when they look at the dollars that have been infused for uninsured children. The other thing that we're doing in this state that this report will see when they look at this past year is the increase in school-based behavioral health liaisons. We're very aware that COVID-19 has impacted kids. Kids have had increased feelings of concern and fear. And so we've been able, through the governor and the legislature, to expand that so that we'll have a school-based behavioral health liaison for every county. And that's another blessing that we've got in this state, where we can wrap all of these services around the child, the youth, and their family.
That's awesome. And Tom, what about your group? Where do you see 2021, 2022 things that you want to improve upon?
You know, what we found is that a lot of folks aren't going to go get help. And so we have to take the help to them. That's why at Mental Health America, we have free workplace wellness clinics. We could even do that via Zoom. We'll go into the schools. We'll come out to your civic group. If you have Alzheimer's and you're a caregiver, we'll come to your house and help teach you how to maintain your loved one at home. And Marie and her group are even now developing these rural behavioral health mobile clinics that will actually go out to those communities. So again, Tennessee, we are headed in the right direction because we are really meeting those needs together.
Yeah, you talk a lot about access and how, like you said, not everyone is going to initiate on their end and seek it out. So you need to go to where they are, which makes perfect sense.
Right.
Absolutely. Thank you so much for bringing that up. Because in our budget hearing, that was one of the things that we talked to the governor about, is this new program that our staff wrote a grant for, where we're piloting a rural behavioral health mobile vans in rural counties, distressed counties. And part of this beauty is instead of trying to figure out transportation where they come to you, we're going to them. And Buffalo Valley here in this region was awarded that grant. And then in Upper East Tennessee and Knoxville region, we awarded the grant to Helen Ross McNabb.
That's great.
And cannot wait to see the outcomes. Thanks for mentioning that, Tom.
All right. Well, listen, I want to thank you both, Marie Williams and Tom Starling. We appreciate you being here and sharing your insights. We're going to take a break and wrap things up, but you both have a great night. We appreciate it. We'll be back right after this.